Hi, so today we're going to look at session 3, which is to look at the indicative context of session 3, which is the aims and objectives for this session, which is for health and social care. So the aims and objectives are to identify key elements of effective communication, to consider a variety of communication methods used within care settings, and to explain the clear communication and why it's so important. We're going to also look at key information on handover notes and justify how others can perceive you as a care worker due to communication skills. So starter is to read all the instructions before doing anything. This is a task that you need to do in your own time. So you need to find a pen and paper, write the name on top of the paper, write the numbers 1 to 5, 1 per line, draw 5 small cycles beside, put X on the second and fourth circles next to 1. On the back of the paper, multiply 7 times 9, put an X in the lower right-hand corner of the paper and say your name out loud. Contact the number of words in the sentence and write the answer beside 2 on the paper. Punch 3 small holes anywhere in the paper. Write today's date beside 5 on the papers. Circle every letter E you've written. Stand up and say I have finished and out loud, then sit down. Now that you have read all the instructions, skip all of them except the first 2. So this is an activity, start activity to show how to follow instructions. So did you follow the instructions? So if you follow the instructions carefully, you should have only had the name, you should have only had your name on the paper, and that's the brain brusher that we look at in regards to effective communication. Communication cycle. So draw this image and make notes from the information in the following slide. So we've got the message is prepared, the message is sent, the message is received, the message is interpreted, the message is understood, feedback is given, and communication is needed. Effective communication. There's key elements needed are as follows. The sender is the person starting the communication. The message is what the sender wishes to communicate. The medium is the method of communication, whether it's verbal, written, signed, electronic, or telephone. And the receiver is the person who receives the message and interprets it. Then understanding the message has to be correctly interpreted by the receiver, and the feedback that is given is the receiver needs to show that the sender, that he or she has received and understood the message. So it's important that for effective communication to occur, you must follow these elements. We sometimes describe that steps that need to be taken for communication to be effective as the communication cycle, which we looked at before. Silent whispers. So line up all facing the same way. Student at the end of the line, read the statement on the paper shown by the tutor. When ready, student to tap the next student on shoulder to turn round. Students to lip read the statement from their colleague, and student at the end of the line to say the statement out loud. So this is a form of effective communication to look at how someone is identifying and speaking clearly. Clear communication. Now, clear communication or clear speech is really important in regards to working in the health and social care profession, because we need to get everything out clear to the individual who is able to speak properly and clearly to maybe a patient that is elderly. If you don't have clear speech, then they're not able to understand what you are saying. So you in the health and social care, clear speech is really a way of speaking that means every word, sentence, and idea spoken clearly and simply Speaking clearly is essentially, particularly when people with service users who may have difficulties when receiving or giving messages. Speaking clearly allows instructions to be absorbed and understood, and if hearing or learning difficulties are involved, then some service can use lip read or use body language to gain further understanding. An example of clear speech is the speaker would say at the modestly elevated vocal volume, "She left for the city on a bus." The pauses give the individual with hearing loss time to process what has been said and to understand the meaning of the ideas before the speaker adds further detail. So it's really, really important within health and social care sector to ensure that the recipients can see, hear and understand the messages that is being conveyed. This could be used in doctor's surgeries in order to ensure the patient understands his or her condition. So it's really, really important to have clear speech. Clear instructions, that's another really important one as well. Using the speech marks, create some clear handover instructions to give to a colleague about a service user. So there's some bubbles there that you can work around in your own time, looking at any sort of instructions to give to people and why giving instructions is so important in healthcare profession. So it might be, you know, for example, go have a wash or wash your hair, brush your teeth. And it's, you know, it makes the person understand when you are giving instructions out, and obviously identifies that they're able to understand your instructions that you are giving out. What effects can these have on communication? So what words are often not pronounced correctly by young people? So that's the fact that, you know, it may be that they're using slang or jargon that is not understood by young people. You know, sometimes that does have effects and issues on communication. And also what words can have different meanings as well, you know, like can't can mean cannot. In different cultures may have different meanings. What words can have the endings missed off? So that again is slang and jargon, and that may have an issue when you are communicating with someone who's either elderly or young person within you know a health and social care profession. Newspaper construction. So hospital worker, this is an article. Hospital workers can't always verbally communicate exactly what they are thinking. This activity will teach you how to use nonverbal cues to accomplish a task. So this is something you can do in your own time, okay? Students to be split up in threes. Students to have 6 newspapers and roll of masking tape. Students to build a freestanding structure and shelters everyone in the group. Students have 5 minutes to plan the structure, during which time they can speak. And after that period, you have 20 minutes to build the structure but cannot speak. So there's a video there in regards to newspaper construction activity. Newspaper construction. So reflect on your teamwork skills. So whether you worked in a team to produce this new newspaper construction, how will the skills you gain support in your career? Any sort of skills you gain whilst doing this activity, because it's so important to identify what kind of skills you have gained whilst doing this activity. And what would you change if you were able to do this activity again? So if there's any sort of changes that you would like to make once you have completed that activity, would have an impact on, you know, the way you deal with things differently. And then non-verbal case study is John. What are the non-verbal signs that John might be depressed? John's ability to communicate with his carers is made worse by the fact that he cannot see. Explain why this is. And this is normally because, you know, he cannot see. And that's non-verbal communication. But you know, he can talk you know, talk to the person and identify that he needs support. He may need his information or any sort of notes or anything in Braille that could help him towards his, you know, experience of, you know, trying to communicate with someone. So, you know, they need to identify his needs, but try to get signs and things in Braille done for him so that he's able to become less depressed and understand what he's communicating, because that's so important in John's situation. So now we're going to go on to unit session 4, which is looking at communication in health and social care again. In this session, we'll look at justifying how information can be hard to read if not written correctly, explain what technology is used to communicate, and also look at identifying social networking logos, identifying what nonverbal communication consists of, and identifying key functions on mobile phones, and explain different forms of communication used in the care setting. So can you change this into a correct English sentence? And this is a jargon or an acronym or text messages on a phone. So this would be, don't be like that, mate. And the next one would be, cool, see you later. And these are jargons that are used and acronyms that are used and abbreviations that are used in text messages. I know you would rather speak to everyone. I know this, and I know this instead of regular talk, because it's much easier to type it all up. So these are things that people use, and young people tend to use these acronyms more than the older people. Changing articles. Find a recent article on the internet relating to healthcare change. Please convert the article into text language. So you'd look at this article and refer to it in, try to look at it in text language. So any article you want to look at on the internet relating to a healthcare profession. So what technology do you use to communicate and write answers on the classroom white board? Hi, Vanessa, are you on now? So what technology do you use to communicate? Write answers on the classroom whiteboard. So infrastructure, telephone services, audio conferencing, voice messaging, video conferencing, web application, mobility, instant messaging, calendar, collaboration, email. These are forms of technology you can use to communicate within an organization. Can you identify the 3 social networking logos? You have 3 minutes. Social networking logos. So you've got Facebook and you've got Skype. And maybe Twitter as well. Non-verbal communication. This refers to messages we send out to express ideas and opinions without talking. Understanding body language is very important, as it often gives care workers a better idea of how someone is feeling than what they say. It's also important that as a carer, you understand when messages your own body language, when messages your own body language is giving to the person you are trying to help. So, it's very, very important to understand non-verbal communication. Mobile phones. Mobile phones have facilities where individuals are able to change the settings to allow the text to be enlarged. The vibration function alerts the hearing impaired that they received a phone call and text message or an email. Posters. Please create a poster about the different forms of communication used in a care setting. So remember, you have verbal, non-verbal, importance of communication, and context of communication. Please be colourful, creative, and informative. This will be displayed in the classroom. So, identify, make sure the poster is, colourful, creative, but also identifies what you are trying to say. So you identify that you're looking at what verbal communication is, what non-verbal communication is, importance of communication, and the context of communication. Self-study, different forms of communication. Access this directed task of study on study guide, and this looks at different forms of communication. This is Unit 3. Non-verbal case study. So how does John's blindness affect the way in which his carers communicate with him? What are the signs that John might be in pain? So if he's got any sort of non-verbal communication would be the sign, for example, if he's showing pain in his face, or he's holding his body where he's in pain, or identifying the fact that, he's saying that because of the fact that he's blind, it may be the fact that he's able to show it in his posture, his facial expression, his communication, how he's communicating to the carer, so it's very, very difficult in regards to sometimes people with disabilities to communicate things across. Now we're looking at session 5, and the content we'll be looking at in session 5 is to explain. Aims of the session is to explain how posture can demonstrate negative body language, to identify positive body language to demonstrate in different situations, to identify what they must consider when communicating, and to justify why listening to information is very important. So starting your posture, so get in pairs and act in different postures by sitting in the chair. Your teammate to guess your posture or feel from posture you have demonstrated. When in the placement, what posture do you need to demonstrate? So it's so important in regards to your posture. We also need a role play from case study, which is John. So in groups of 3, role play and interaction between John and his carer, where John has eaten very little of his lunch and is reluctant to say anything other than yes or no. One of you should act as the role of John by being blindfolded and sitting hunched in a chair so you can't see the carer. Use your body language to portray how you are feeling. So, make expressions. One of you should act as the carers, and one of you will observe and take note of the interactions and body language use. So this is something that you can do in your own time in regards to the role play. In groups of 3, play an interaction between John and his carer, and John has eaten very little of his lunch and is reluctant to say anything other than yes or no. Think about how it must feel not to be able to see anything but black all day, every day, and what it must feel like to have people coming in and out of your room when you have never seen them. So have an idea of what they look like or who they are. After the first run through the role play, discuss how the carer could improve by using body language, which John can access despite being unable to see. Repeat the role to show his improved body language. What must we consider when communicating? So we need to consider the context of communication, how we can communicate with each other. Be it one-to-one, be in a group, what someone feels comfortable with, who we communicate with, parents, carers, or service users, a child, a patient, professionals, doctors, nurses, any other needs that we could take into account. So we need to take into account any sort of needs such as cultural needs, the fact that, their culture may not permit them to shake hands. the fact that their culture identifies that they cannot hug. We must consider the age as well. It's really important to consider the age of an individual, because some elderly people, we must consider what disabilities they have if they can't hear, you know, and if they are young, then do they understand what we are saying? Because that's important for young people, because sometimes young people don't understand what we are saying. Also, there's other reasons. So it could be disabilities. It could be things like time and the resources. We need to also make sure that when we are communicating, and to make sure that communication is effective, we must be clear on what we say, and correct and complete and concise and compassionate. We must consider the 5 C's of communication, though they may vary depending on who you're talking to. And we must also consider, things like different factors. There may be things like, especially in the health and social care, like I mentioned, it may be the fact that, someone's quite old. We must consider their age, their disability, their illness, these things that will be taken into consideration. And if we must either speak quite slowly, at a slow pace, allowing them, a lot of time to process what we've said and respond. Avoid speaking sharply or raising your voice, as this may cause distress as well. And don't talk as if the person isn't there or like a child. So we must show that we are respecting their views and their cultures, and be patient with that person, because it's so important, especially in the health and social care, to be patient and to have effective communication, and make sure that the patient, or the individual that you are talking to, understands what you are saying, but also understands any sort of problems that they are having, and you're able to consider any sort of concerns that the patient is having. Use open-ended questions to reveal more details about the patient, and listen carefully if you're talking to a patient. The patient's answers will help you learn about the patient's core beliefs. So it's so important that you as an individual are able to understand that. Listening is a really, really big part of communication, because if you're able to listen, then you're able to understand what the person is saying. So communication is a two-way thing. It is much as about listening and understanding others as getting your own messages across. Good listening involves giving the person your full attention, showing that you are interested in what they have to say, and occasionally summarizing what they have said to be sure that you've understood. And, it shows that you are acknowledging the person and that you are engaged in the conversation. And sometimes, in good listening, you would, if you're talking to a patient or an elderly patient, again, you would either nod your head to show that you are, you are listening, and, also, maybe use encouraging words such as yes, and I see. Empathy lets a person know that you understand how they feel, and when you are listening to someone, it earns a lot of trust and boosts their confidence, especially in the healthcare profession, where you're listening to patients and they feel encouraged to share their concerns with you. Things like sensitive information, and you have to show that you are attentive, and you are earning that patient's trust, because it's so important, especially in health and social care, to be able to listen and understand what the individual is saying. So if you're some examples of communication in health and social care would be, if you are listening to the individual and you're discussing a treatment plan with the patient, you are giving instructions, communicating. These are important things when it comes to listening, because a lot of us think that we always listen to individuals, but sometimes if we're not paying attention and we've got other things on our mind, they are thinking that we are not listening, and you need to be engaged in the conversation. You need to show that you are listening, and you need to show that you are involved and you are fully connected with the individual when talking to them. There's a video and a link there that you could go on to when looking at the listening, looking at listening as a communication skill. Active listening task, and this you can do in your own time when you have time to do it. I'll just go through that. So, working pet groups of 3. Person 1 should choose a topic. Person 1 should choose a topic to talk about. For example, your family, what you did last weekend, a hobby or an interest, or your favorite music or film. You should then talk about this topic for 1 minute. Person 2 should listen and show interest in the topic. And person 3 should watch carefully and make notes on the grid provided. Repeat the above twice, but in different roles, so that each of you gets a chance to be the speaker, the listener, and the watcher. And when we talk about active listening, in the health and social care profession, it involves paying attention to what the other person is saying. So to acknowledge that you are engaged in the conversation, like we said earlier, you can nod your head, make sounds, and use encouraging words such as yes, I see, and show empathy, because that's so important. This skill of listening included verbal and non-verbal items as being good active listeners. Different factors should be considered, such as, appropriate body movement and posture, showing involvement, facial expressions, eye contact, showing an interest into the speaker's words, and verbal encouragement and attentive silence. So, you being silent and listening to the person will encourage that person to say what they need to say without, holding back. And sometimes the information might be sensitive, so the person will hold back and get a bit upset if they're not discussed properly. So active listening team task. Did everyone within your team join in the task? What did you find hard about the task? And feedback, some interesting information from notes you've created. And what have you learned about communication from this activity? So non-verbal case study in regards to John. One day John woke up and was able to see fuzzy shapes, such as the pattern on his apron. However, he didn't tell anyone in the case. It went again. How might his body language have changed so that his carers could tell that something was different? He may be being able to, he's maybe upset. His, body language could be that he's, he can't, he's seeing fuzzy shapes. He may be excited, and he may be able to, he may have a sense of happiness. The next day, sight had totally gone again. How do you think this has affected John? How will his body language change? He may be upset. He may be so upset that it's changed the day after. He may be thinking that, he could see from the last, from the day before. And then he may be upset. He may be depressed. He may be distraught. He may be upset from, he may be crying. Who knows? His body language will portray a lot to him, to the carer, to show that, how he's feeling. Because he may have felt the day before, he may have felt good about everything. But then the day after, his sight has totally gone again. So he may feel upset, he may be anxious, he may be crying, he may be, he may be depressed, he may be, crying. Who knows what he'll be doing, because his body language will be able to portray that to the carer. She'll be able to understand that his body language is that he's been affected by this. It's affected him quite a lot. So we've finished this session now. Okay, the next session we've got is in regards to session 6, which we'll be looking at next. So I'll finish the session off now, and then I will see you in the next session. Thank you.